good people. I have had a very rough day today, receiving distress calls from women from various corners of this country. Since we launched a call center that helps our women to report extreme cases of human rights violation when they're in hospital for childbirth, our call center has been very busy. Today, I note with a lot of concern that there are still hospitals that are still not able to embed the SHA and SHIF services to Kenyans, and more specifically to the women who have sought medical services during childbirth. So today, we have reports that there are women held up or detained in hospitals like Mutwine Hospital in Nairobi County, Nanyuki, in Laikipia County, Nanyuki Referral Hospital, Nyeri Teaching and Referral Hospital, and Thika Level 5 Hospital in Kiambu County. Last week, we had a few women from Samburu County that were released after we intervened. The other week, we had 2 women from Lamu that were also detained in hospital, but after our intervention, they were released. I am happy that the call center that you helped us to launch, a national call center to help women in distress whenever they are in hospitals, whether private, faith-based or public, is now fully functional. That call center is receiving calls from all corners of Kenya. This is my initiative to make sure that we deliver respect and dignity for mothers as they seek delivery services in our hospitals. For a long time, mothers have naturalized violence during childbirth. They have been abused, they have been neglected, they have been ignored, and to some extent, even detained in hospitals. Some mothers have even reported that their children were either exchanged or stolen while they were in the labor wards. This has to stop. And I'm glad that this campaign, Heshimu Uzazi, is now filling up in this gap. I want to take this opportunity to thank all donors and supporters who have come through to support our campaign. But we still have a long way to go. We have to make sure that we get partnerships and networks of doctors, lawyers, counselors who are coming in this campaign to pick up cases and press for justice on behalf of oppressed mothers. I want to thank all the lawyers who have come in to support in making sure that we trace babies that have been stolen in the arms of nurses and doctors in our public hospitals. Thank you, team, for coming through. I want to also thank all the partners who've come in to help us to make sure that our free toll line is functional and is operational. At least, and finally, mothers can call that number, patients can call that number without being charged. It is now our time to make sure that we buy or acquire some ambulances that are going to help us to rescue patients in distress. We have had a few mothers calling us after they have gone through theater, and upon recovery, they've realized that they have some substances or foreign materials left in their uteruses. We had an extreme case in Nakuru County, and we thank the Nakuru County government for intervention after our call. We have had other cases that are still pending in Migori and in Homa Bay, and we hope that by the end of this week, that will be sorted out. Heshimu Uzazi campaign is continuing to provide a platform for Kenyan women to deliver in dignity and in respect. It is my duty as a mother and as a leader to guide and to patronize this campaign to make sure that we dignify our mothers into motherhood. Our free call toll line is active. You can call if you have a patient you would want to help, especially those patients who are detained in hospitals and those whose rights have been violated either physically or by institutions. We are calling it Heshimu Uzazi. Stop obstetrical violence. Stop OBV. Our toll-free line is 00800 724 344. 00800 724 344. Heshimu uzazi. If you want to support us in any way, especially to make sure that the women who are in distress detained in hospitals are released, and many other interventions we are providing, including legal services, please get in touch with us. Click